Good evening, hello, and welcome to Mbia Nyamkuta Glass Table Talk. And a very happy new year. I hope you've made some resolutions and you're going to stick with them. For me, my resolution is positivity. That's my resolution for the year. You can always find the best out of any situation. Let's cultivate a attitude of gratitude and positivity. Okay. Our topic for the first topic for the year, I'm going to carry on our labor journey. And if you remember very well, we said we are going to use the analogy of a car journey. This is a car that is setting off from home. You navigate the roads in the locality until you get to a highway, motorway, freeway. So we are setting off. We've got everything now in the car. We've got our fuel. We've got all the essential oils and fluids. We've got all that. We've got our bags. Tapeza. Now we are sitting in the car. So, just like a car, you don't just start like zooming within the neighborhood. You go at the recommended speeds in the neighborhood. You go at lower speeds, probably what they call the higher gears, gear number 1, 2, and 3, because you're driving at most maybe at 30 miles an hour. So, likening that to our body, it's like the latent phase of labor. You are on your journey, but you're only at the beginning of your journey. You're driving in the locality. You're using low speeds. This is the latent phase of labor, if we are looking at it as the latent phase of labor. So, what classifies as the latent phase of labor? It's not, remember we talked about forced labor and also talked about true labor. This is true labor. So you're still having irregular contractions, period-like cramps. And one thing to note though is the latent phase of labor, especially in first-time moms, can take 24, 48, even up to 72 hours. This is your body getting into labor, but it's thinking of getting into labor. It's nudging itself into getting into labor. However, all these come with some pain and some discomfort. I'll get to that. What is really happening to your body? Just like you are covering part of your journey as you drive out of the neighborhood, the cervix is getting shorter, what we call effacement. I will attach a video to this that will show you what we are saying when we say the cervix is shortening. Because before labor, let me just explain. Before labor, your cervix is long and tubular and it's tugged at the back. As you get closer to labor, as your body makes its exchange of estrogen, progesterone, prostaglandins, your cervix migrates from the posterior part of your uterus, migrates to the what we call the anterior, to the front. And when it gets there, under the influence of the hormone prostaglandin, your cervix starts to shorten. It starts to soften first under the influence of the hormone prostaglandin. Then when it shortens, when it softens, it starts to shorten. Take note of what's happening to my fingers. It's shortening until it gets to here. Then it starts to open. It might start opening up there, but it doesn't go far because there is still some length to the cervix. So it then starts to, once it gets what we call fully phased, when it's completely thinned out, it's paper thin, it starts to open. That's when you start talking of the progress of labor. So the latent phase of labor, I see a lot of women getting a little bit disheartened when we tell them that, oh, you're only 2 centimeters or your cervix still not open. But as a midwife, I'm also thinking, In terms of centimeters, yes, this woman might not have progressed that much, but in terms of what we need for at that point in latent phase, which is the softening of the cervix and shortening of the cervix, you are dilating. You are having progress, not dilatation. You are having progress, because I'm looking at how thin the cervix is, how short the cervix is, how soft the cervix is. Because if your cervix is not thin, if it's not soft, then the progress of that labor is not going to be as efficient. So the rule of the thumb there is if you are told that your cervix is, like, let's say you're 2 centimeters, before you get disheartened, because you might have gone maybe 48, 30 hours, 72 hours, still having those nigglings and pains, you might be disheartened to think, oh, all that pain and I'm still just 2 centimeters. No, ask your midwife, is the cervix shortening? Is it soft? Because for me as a midwife, I'm not even looking at the progress as much in the terms of dilatation. I'm looking at the progress as to the shortening of the cervix and the effacement, because I know that's where the real hard work is. It's like covering that first part of your journey where you are navigating from whatever street into whatever street into whatever street. You take this junction, you take this dual carriageway until you get to the motorway, until you get to the highway or freeway. That is what as midwives we are looking at. So sometimes it's characterized by you'd start maybe by feeling some backache, some period like pain, which gets gradual and more persistent as you get closer to start what is called established labor. You might also lose what is called a bloody mucus. It's gross. It's like proper snot with brownish blood in it. Yeah, it's gross. That's all I can say. But that's a normal part of labor, and we know that there is some activity happening in the cervix when you see the bloody show coming out, because that show, once the cervix is long and tubular like that, that show stays inside the cervix. Its protection is to anything ascending that might ascend into the uterus. So that show plays a part during pregnancy. It plays a part. So when you see that coming out, it means that there is some activity. The cervix is starting to open. There is nothing to hold it there, so it falls out. So that's a very good sign that something is happening. Something is going on. And the other thing is when you the other sign that you are in latent phase of labor, your waters might break. And when your waters break, it's not like what you see in the movies where someone sneezes, waters go and they're rushed to hospital, they have a baby straight away. It doesn't work that way. Your waters might go, it might start trickling, you might notice that your knickers are wet. The advice there is to wear a pad. When you wear a pad, then check the pad. And when I mean pad, I'm not talking of those thin panty liners, proper maternity pad. And you get a good look at it to see if the water clear, straw colored clear. Is the water not having a foul smell? Is the water not green? Is the water not blood stained? It might be a little bit pink, but it shouldn't be blood stained. It shouldn't be too bloody. If it's bloody or if it's green, or if it's still clear, you need to phone your midwife and let them know that is what has happened. However, waters can go, and you can go up to 48 hours without actually going into proper labor. The other sign might be the urgent need to pass urine or open bowels. That might be other sign of latent phase of labor. What should you do when you're in latent phase of labor? What should you do? We always say talk of relaxation techniques. Try to stay at home as long as you can. Some breathing techniques. If you go on YouTube and Google some breathing techniques for labor, then you might find something that can help you. You might want to find a position that makes you comfortable, using a heat pad or cold pack. Those who can use TENS machine, you can start using TENS machine. Take some paracetamol, 1 gram, if you are not allergic to it. Don't take 500 grams unless you have got such a tiny body, but a normal adult dose of paracetamol is what you need, especially in the latent phase of labor. Here women saying, I don't want to take anything, my labor will stop. Let me make it clear. If we are going into proper labor, paracetamol is not going to stop proper labor. But what we are just trying to aim at is to reduce the stress levels, to reduce the anxiety, and to reduce the pain. So nothing will stop true labor if true labor is coming. And you can, like I said, you can use the TENS machine. TENS machine are brilliant. You stick them on your back, you press a button when you have a contraction. They work on blocking the pain pathways. I'm not going to go much into that, but that's how they work. They work brilliant at the beginning of labor. So that was our latent phase of labor. I'll see you in the next video. Thank you.